Hi, I'm Alex and I'll be your nurse today. Can you tell me what brought you in?
Yes, ma'am. I've been having very watery diarrhea. I go at least 6 times a day and it's so loose it makes my butt hurt. I also been having fever. Last night it got up to about 102. I'm very nauseated and my abdomen hurts really bad.
Okay. Can you tell me how long this has been going on?
It's been a little under 2 weeks.
Okay, Ms. Jeffries, I think you may have Clostridium difficile. I'm going to give you a little information about the pathophysiology. Clostridium difficile results from the disturbance of normal flora in the colon, colonization by C. difficile, and the release of toxins that cause mucosal inflammation and damage. It is caused by prolonged antibiotic therapy that destroys both good and bad bacteria in the colon. It occurs primarily in hospitalized patients.
Can you tell me what type of test you will run to confirm that I have Clostridium difficile?
Okay, for the diagnostic testing for Clostridium difficile includes a stool specimen testing, which tests for white blood cells, parasites, blood, mucus, and toxins.
To treat Clostridium difficile, there are several medications and treatments available. For mild to moderate Clostridium difficile, the first line of treatment is metronidazole, also known as Flagyl. For severe Clostridium difficile, vancomycin is the medication of choice, and if a patient is non-responsive to metronidazole, they will also receive vancomycin as treatment. Other treatments include solution containing glucose and electrolytes, also known as Pedialyte, to treat dehydration. There is also a treatment called fecal transplantation. Fecal transplantation is the transfer of stool from a healthy donor into the gastrointestinal tract for the purpose of treating recurrent C. difficile colitis.
Oh my God, how should I manage having C. difficile?
Ms. Jeffries, here is some patient teaching you might want to know. Wash contaminated clothing immediately with soap and water. Avoid prolonged use of antibiotics, histamine H2 receptor blockers, and proton pump inhibitors. You should use hand hygiene with soap and warm water. C. diff spores can survive for 70 days on objects including commodes, telephones, thermometers, bedside tables, and floors, so you'll want to clean surfaces with 10% bleach or a C. diff sporicidal.
Some complications of Clostridium difficile are fluid volume and electrolyte imbalances and recurrent Clostridium difficile.
When caring for a patient who has C. difficile, you should use PPE, which includes gloves and gowns. Use disposable stethoscopes and thermometers. Clean with 10% bleach solutions on all surfaces. Wash hands before and after patient contact. Flush vomitus and stool down the toilet.